Hi there, I'm DrNathan Chandabel. Been here a little over 2 years at Mineola Healthcare, and today I'm going to be talking about skin screening. So skin screening is going to be looking for multiple types of skin cancers. Typically the screening can be scheduled yearly. Sometimes it doesn't need to be that often. What you can expect during a skin screen is that the first appointment should start out with a conversation about your risk to determine how often you might need to have the skin screening performed in the future. You'll then be asked to change into a gown. This exam can be a very personal exam because it tends to need to be a full body exam. The reason for that is that things like melanoma tend to grow in non-sun exposed areas as well as sun exposed areas. So we tend to need to see as much skin as you're comfortable showing. At the same time, if you're not comfortable showing certain areas, we're happy to examine what you are comfortable with because some exam is better than no exam. Expect a cancer risk conversation as well as a direct skin visualization to be the only things performed on that day. We tend to reschedule biopsies for a date in the future just to make sure we have enough time to do those procedures. It takes about 15 to 20 minutes to do a thorough skin exam. These exams can be really important for us to show you spots that we're worried about that we want you to watch over time, as well as you showing us spots that are worrying you. We also really want to stress that you doing your own skin lesions are probably equally as important as us doing them in the office. Get your partner, your family members, close friends involved in your skin screenings. Things like your back, behind your legs, things that are hard for you to see, and that can help to make sure that we don't miss anything during these exams. Melanomas tend to be the most aggressive forms of skin cancer, which is one of the main reasons we do these screenings. Depending on how high your risk is for melanoma, we may screen you more frequently. I wanted to go over some of the higher risk criteria so that you guys are aware if you fit into any of these when determining if you need a skin screening. I've got a list because it's a little bit long. Personal history of skin cancer, family history of melanoma, more than 5 atypical or dysplastic moles after biopsy, multiple blistering sunburns, more than 25 to 50 moles, light skin with freckles and red or blonde hair, history of indoor tanning, and all men greater than 50. Lastly, let me talk about biopsies. They tend to be pretty painless. The numbing medicine feels like a bee sting, and that's about the only pain you should feel. We can either shave the lesion, punch the lesion out, or sometimes we have to remove the entire lesion with an excision. But those things can all be done very easily in the office. If you have any more questions, feel free to contact our office and we'd love to talk with you about it. Thanks.